Grant Headley here, DPT. Just doing a few little things here to take care of my knees, to keep those pesky little lateral IT band and anterior top of your kneecap pain away. So first, doing side plank. And again, all these, you might have done these all before, but it's all about the form. So with this, make sure you're pushing down in the outside edge of your bottom foot, stacking the hips, roll onto that outside edge of the foot, drive the hips forward, stack the shoulders, keep your head in line with your spine. Don't drop down too far, but also don't arch up too high. And if the first variation is easy, then you can pick that front leg up. The foot strength is so important here because if you're sickling your feet, then you're going to cause more tension in your IT bands. All right, the second one here, you get into a good old plank, and then you start playing around with your hip. You lift one leg, you kick your heel straight up to the sky, kick out to the sides, draw your knee into your elbow, maybe 10 times each variation. Draw it across your body, kick to the side, kick up. Try that 10 times, and again, while you're breathing. And then you switch sides. Kick up. You're going to feel that leg that's stabilizing, that bottom leg, that's going to be burning. And that's what we want. We are helping that anterior thigh be strong. And notice how we're trying to limit how much excess motion is going on there in the mid-back. It's like if you put a glass of water on your spine, you don't want that to spill. So we're teaching the body how to move together and stay stable and breathe. All right, this last one here, straight leg raise. Again, a simple exercise, but it's all about the refinements. So number one, are we breathing? And look, I'm kind of stiff on this left side. Now let's really get our glutes activated. Let's get our glutes firing. Let's reach through those toes. I can go a little bit higher. Go a little bit higher on the right side. So we're inhaling on the way up and then exhaling on the way down. Or you can try the breath in the other variation and see, how the different breathing patterns change your movement. So always be experimenting with how you're breathing, what you're using together, how you're relaxing or activating things affects your movements. And you're trying to keep that bottom leg as still as possible. And notice the more we practice this, the more smooth and fluid it gets and the higher up that leg goes. Trying to keep that back as flat as possible on the ground. Try going back and forth, 10 to 20 times. And this is a hip exercise. It's a core exercise. But we're teaching the lower extremity to move smoothly on our pelvis. And you could argue you're also strengthening the anterior thigh, those quads. And there's some research that shows that quad strength, surprisingly, is a factor in knee pain with cyclists and runners. So you'd think that the quad wouldn't be a problem with all of the over-exercise that we do with endurance sports, but it's kind of interesting if we do a little bit of coordination work for the pelvis, the breathing, the entire lower extremity, how we can help it all work together. And then, good test is how it finishes up. All right, that's all we got for that little section. So repeat that cycle, 2 or 3 times each, and see how it works, and practice right when you get home from bike ride. All right, try it out. Bye.